Okay, we'll get some time for everyone to go through that. So right now we've got about a 30% getting some of the responses in. We've got about just over half of you are staff of organizations. About 30% would be of the executive director cohort, and then a few others. So thank you so much for using that feature. Now, we would like everyone to use the chat feature on the right-hand side of your screen. Please enter your name and your organization. So we're seeing some folks using that function. We will be asking questions of the audience during the presentation, so feel free to use those two features, and we'll be answering those questions as we receive them. Now that we have those tasks out of the way, let's get to know our speaker. Paul Schmitz is the CEO of Leading Inside Out, a nonprofit and philanthropic advisory firm, senior advisor to the Collective Impact Forum, and the first innovator in residence at Georgetown University's Beek School of Social Innovation and Impact. Paul is the author of Everyone Leads, Building Leadership from the Community Up. Paul previously served as CEO of the National Leadership Development Organization, Public Allies, was a social innovations advisor to the White House, and has been named to three separate years to the Nonprofit Times list of the 50 most influential nonprofit leaders in America. In this presentation, Paul will share some insights on how to ensure equitable participation and results from collective impact efforts. It is important when mobilizing a community to solve a problem to make sure that we are truly engaging all parts of our community and achieving results that work for everyone. During this presentation, attendees will learn the basics of collective impact, the elements that have made it successful, and a framework for assessing the equity of collective impact efforts. At this time, I'd like to turn the call over to Paul, and we can begin our presentation.
So make sure we get the...
Hi, everybody. This is Paul Schmitz. It's great to be connecting with all of you today. And along with the questions, I'll also supply my... there we go. There we go. Are we up?
Yep.
Yep. All right. Great. So I'll be happy to also answer questions on Twitter at @PaulSchmitz1 after the conclusion of the program. And the websites for both my work and the Collective Impact Forum are at the bottom. So today what I wanted to do is really help people understand the basics of collective impact and the leadership values and culture that enable success. I'm going to first talk about the basics and kind of what it means to also practice system leadership in this context. And then we'll take a break for some questions. Then I'll come back and talk about leadership values. And equity really gets woven into all of this. First, I want to talk about how I kind of came to collective impact. In April of 2010, there was a headline in the Milwaukee Journal-Sentinel, where I live, that said we had the worst fourth grade reading scores for African-American children in the country. At about that same time, I got a newsletter from a large youth organization talking about all the outcomes it was achieving with the children it served. And I felt this for a long time. I'd wondered about how we had all these nonprofits in our communities achieving all of these outcomes, yet we weren't seeing change at a community-wide level. And so for me, that was a real concern. About a year later, there was a different headline in the paper that our teen pregnancy rate, which had been one of the highest in the country, had started going down. And it credited the fact that the United Way and the city health department had been working together to pull all the providers together to begin working on a common strategy to do that. At that time, when they did that, they pulled together all the groups that were being funded to work on teen pregnancy. They found that almost all the groups worked with girls. They realized there was another half of the problem. Not only that, when they looked at the data together around teen pregnancy, they found that the majority of teen fathers were men. Were men, of course, or men over the age of 18. And so they found that issue that no one was addressing in the community. And the United Way began a number of comprehensive strategies from sex education, comprehensively up through advertisements in the community about the issue of statutory rape. And what I find is the funny little story here is that the controversial poster among these was actually the girl with the snake is the one that got the most protests at the United Way, because there's an association of snake owners that get concerned about snakes being seen as predators. And Mary Lou Young, the CEO, said of all the ads they did and all the work they did funding Planned Parenthood and all these other controversial things, they didn't expect snake owners to be the biggest problem. But they pulled everyone together. They used data to develop a strategy. Everyone realigned their work behind the strategy, and in 7 years, the teen birth rate in Milwaukee is down 57%. The basic idea of collective impact is it begins with this notion of a common agenda. Everyone comes together and figures out what's the result in the community we're going to strive for. This should be a measurable common result, and you build a strategy together based on that result. There's shared measurement that everybody is tracking the same indicators to move that we know will move that central result we're trying to achieve. And everyone's data is transparent and shared with each other and collected that way. There's mutually reinforcing activities, and to me this is another key part of collective impact is for a lot of us we've been part of collaborations or coalitions where I have my daily work at my organization and the collaboration is something I do on the side. In collective impact, the collective work becomes my primary work every day. So I'm not doing collective impact on the side. My work at my agency is the collective impact and driven and governed by that common agenda and the shared measurement. And there's a process of continuous communication, meetings, and a process in which we continue to align our work, look at data, share information, align our work, and connect around solving that problem. Managing all this, and I think there's another big piece of what collective impact has brought as a model, is what we found when we started looking at collective impact was a lot of the efforts had this backbone group. There was some organization or shared practices among a few organizations that managed the collaboration process. They helped facilitate the common agenda. They helped pull together the data and analyze it and share it for the shared measurement. They met with the groups to connect the dots and help them reinforce their activities. And they managed the meetings and facilitated the continued work to keep the communication flowing among the groups. The backbone role is actually very, very important to collective impact. And as I said, I think it's one of the I've been part of a lot of collaborations in the past that hadn't succeeded because there was no one kind of moving the process between meetings. You had a lot of well-intentioned people who were busy and would go on to do something else. And what we found when FSG looked at the role of backbones is that the great backbones guide the strategy and the vision. They also support the aligned support aligned activities, and they establish a shared measurement, build a public will, advance policy, mobilize funding. And it's usually done through a series of committees. And so really what they've got is typically a steering committee that governs the group, perhaps a program committee that's more directly involved in the work. You have committees around any of the goals you've set for the community-wide indicators you're trying to do that pull all the people who work on that together. Typically there's a data group that's working on the data and evaluation, communications, policy, funding, and usually the funders are at the table as partners in the effort, not just funding it. And the backbone, again, facilitates all of that work, connects it all, and makes sure that all the trains are moving, all the boats are rowing in the same direction, all the trains are on time. One of the things we think is really important in thinking about collective impact, when we think about this model, is that there's shifts in thinking that are involved. The problems that we face are systemic, and so the solutions have to be systemic. And to get there, we have to lead a little bit differently. And the first part of that is really embracing kind of a system leadership perspective, which begins when we get off the dance floor and go to the balcony, when we move from our day-to-day concerns and issues and take that broader field of vision on the problem, on the issue, on the solution we're trying to work on. The second is separating technical from adaptive issues. And the third is understanding and testing mental models. And finally, diagnosing, hypothesizing, proposing, but after we've done the other pieces. And I want to talk about those middle two for a moment. One of the big challenges with collective impact, I know a lot of us have experienced this past, is when we try and solve a complex problem or an adaptive challenge with a simple solution, it's not going to work. Again, our problems are often interrelated, issues are connected, and we need systemic, comprehensive solutions to address them. And so we have to separate out what's a technical issue from what's really an adaptive or complex issue. And so we might find within a complex issue there's technical things we can fix. In the case of an effort to reduce juvenile incarceration in New York, which was a comprehensive and adaptive challenge, but one in which they eventually moved it by 45%. But when they started pulling all the people together to meet, one of the things that came up was the heroin overdoses on Staten Island. And one of the pieces of information that was found is that one of the public health professionals explained that there was this EpiPen that could be used that would bring people back to life fairly quickly. And the technical solution was making sure that that was in every police car in Staten Island. That was a technical solution to a technical problem. But the problem of reducing drug addiction and drug dealing and reducing people's involvement in the incarceration system required a much more comprehensive and adaptive solution. So we have to separate what's something that can be solved in a technical way from what can be done in needs an adaptive, systemic approach. The other thing I want to talk about here is mental models and how we have to shift the way and frame in which we typically see things and look at things in a different way. And I want to use the example of kind of how we often design strategy in nonprofits, which is often moving from activity to results, and how we need to shift in collective impact to results to activity. And here's what I mean. Typically, a nonprofit begins by identifying a need they want to serve in their community, building a service to address that need, and then they start measuring outcomes with the hope of creating some type of virtuous cycle or flywheel that starts to move that solution, accelerate that solution toward the broader community. Then they hope to grow the program, and then the hope is that others are building their flywheels too that are serving the same population. And if we all do that, we can achieve a population impact. And what this model really does is it starts with organizations each kind of pursuing their own outcomes with the hope that if everyone pursues their outcomes, the community will get better. We don't find that often happens. We often find that we have lots of good work in community, lots of organizations achieving outcomes, but we have the same graduation rate, the same teen pregnancy rate, the same poverty rate. Collective impact reverse engineers this. It starts with a population level goal. What's the indicator for the whole community we're going to move? And we've got to be clear, what is the specific result and what's the indicator or measure that will tell us we've succeeded in our community? Then we have to understand what's the story behind the curve. If we did nothing, what does the curve look like? What does that line look like over time? And what do we know pushes that curve up and what do we know pushes it down? That's that factor analysis. And using real sharp data analysis and evidence to look at what moves that number up and what moves that number down. As we understand it, we look for levers and we figure out what can we target within that. Where can we actually have the most impact on that result? We use data and evidence to figure out what actually moves those targets, and then we figure out who all do we need to do the work that will achieve that result. And that's when we get to what programs, who does them, how do we align them. And here, it's not about finding programs to all do a little more and better what they're all doing. It requires the programs who are part of it to probably fundamentally change what their services are and how they work in order to meet the demands of the results. And so that's really the shift. The biggest shift in collective impact is to really be disciplined and resolute about being result-based and making sure that the work you're doing is moving that end result. And just a quick example here is, in Milwaukee, I'm involved with an initiative around infant mortality. And when we looked, and a lot of the press and media around infant mortality focuses on sleeping deaths. But when we looked at the data, at the story behind the curve, we found that 60% of infant mortality is a result of premature births, about 25% birth defects, and about 15% sleeping deaths. So if you're trying to move the indicator, you would focus on that 60%. That's the biggest lever. And then you look at what do we know produces healthy birth outcomes among women. But when we looked at who was doing most of the work happening before around infant mortality, was focused on sleeping. because but that only moved 15% of the problem at best. And so what you have to do is really start with the result and move backward and put aside your mental models, your assumptions about what you already do, and use the data and evidence and analysis to figure out what needs to happen to move the result. So let me stop there, again, looking at these system levers, and ask if there's any questions at this point. And really asking people kind of, what do people find compelling in the collective impact model? What's challenging in it? And what kind of questions do people have? And we'll take a break now for some questions.
Sure, yeah. So the slide that you're seeing right now, if you have any questions regarding any of Paul's early presentation here, feel free to share them, or any comments. I do have one comment to share, that there's an individual who's attending here from Racine and Kenosha, and they're also engaged in the same infant mortality efforts mentioned by the presenters.
Oh, the Life Course Initiative, yeah. Yep.
So they can definitely relate, and
great.
Yeah, I think that's great.
So do we have any questions that I can respond to?
Sure. So feel free to use the questions box or the chat box. We'll hold off for a little bit for a couple questions as they come through. Otherwise, we will kind of hang tight for a little bit.
Oh, they're not seeing the video. They're only seeing the slides being done. How do I share? It says share my webcam.
Looks like they were, I thought they were seeing that. There you go. Yep, there you go.
But they're not seeing it on there.
I'm seeing it on their screen, which could be, that might show up on a different, because we have it hooked up to a projector.
Okay.
So it might show up on a different screen. So, all right, we did get confirmation that they can see you. so that's good. Everybody's using the chat feature and box very well. So
what questions do people have?
None.
Or comments?
Comments, we can see you. So that's a good sign. So hooray for technology. And I think, can you talk a little bit about the story behind the curve?
Yeah, so if you think that if we did nothing, let's just say that we have a 60% graduation rate. And the assumption would be that if we did nothing, it would continue at that level. Maybe it's even going up a little bit each year. The question is, how do we bend the curve? That's what we're trying to do. And the story behind the curve is a question of what do we know, what do we have data and evidence about that actually impacts the curve? And so not what our assumptions are, but what do we actually know? And so as I said, if we're looking at infant mortality, we know that when we look at the data, we know that the things that are going to bend the curve most, if more babies come to full term, you're going to have fewer infant deaths. We know that if women aren't smoking when they're pregnant, that'll have an impact both on premature birth. It'll also have an impact on the sleeping death. And so the thing is, you have to look at the evidence and data to figure out what are the actual strategies that are going to move, that are going to bend the curve, and to understand what are the factors that will move the curve up and what are the factors that move the curve down. And so it's really understanding that and doing rigorous research on that before you get to discussing programs. And I think what people do is they run to programs before they really understand, and they start to assume that program outcomes equal evidence of impact to move the result, rather than starting with the result and figuring out what actually moves that and aligning the work behind what we know works.
Great. Thank you, Paul. So looks like it's kind of slow going right now for the questions.
So we'll come back to the questions. I'll go into part 2, and then we'll go from there. So let me, great.
One question did come across.
Okay, sure. I can take that real quick.
Okay. What strategies have been effective at getting current program managers to work collectively?
That is the perfect segue into the next part of the presentation. So I'm going to use the next part of the presentation to answer that. So, as I mentioned, there's these 5 components that are well known behind collective impact. And I should just mention that The article in the Stanford Social Innovation Review in 2010 by John Caney and Mark Kramer was the result not of something they created, but of something they found when they looked at communities where there had been population-level change. In 2011, the White House Council for Community Solutions, which I was on, started right around the time that article came out, and we undertook our own study, and we looked at 100 community collaboratives around the country, and we found about 22 where there had been a 10-point or greater change in a population-level result, and we found a similar set of dynamics. And so I always like to say here, people say, well, it existed before. Of course it did. It wasn't something that was invented by an article. It was something found, and it was something that had grown organically in a lot of different communities. As I said, in the White House Council, we found 22 examples of this that had worked, and I think it was just born by groups that were tired of not seeing that change and wondering how can we build the system to do that. But what we find is that these 5 elements that are so crucially found everywhere, I believe there's a 6th that in my work I found more and more crucial over time. And I like the quote by Peter Drucker that culture eats strategy for breakfast. And the reality is if you don't build the culture for collective impact, the strategy won't work. And that's kind of going back to that question. You have to build the leadership values and culture that'll help it to succeed. I wrote a book a few years ago called Everyone Leads, Building Leadership from the Community Up. And the basic idea was not that everyone should be in charge at the same time, but that leadership is a muscle that everybody has. And like every muscle, it only gets stronger with exercise and practice. And that the goal of any effort should be to build collective leadership muscle. And so it's not about finding a leader, it's how do we build leadership. And the definition that we use to define leadership is based on 3 ideas. First, that leadership is an action people can take, not a position you hold, that the verb is much more important than the noun, and it's really about how do we engage people to take the action. The second is what is the act of leadership? The act of leadership is an act of responsibility. It's someone stepping up and saying, I'm willing to do what I have to do, willing to work with who I have to work with. They own the result. They're going to do whatever it takes to achieve that result. So leadership, in essence, is an act of responsibility. And then the third part is about the practice of values that engage people to work together. Because people will only work with you if you're someone worthy to work with and who they like working with. And that's why values are so essential to leadership. And I want to tell a story right now that you all know to kind of illustrate this notion of collective leadership. And it's the story of Mrs. Rosa Parks and the Montgomery bus boycott. And I like to tell it in a different kind of way that I think really illustrates this idea. And first I'd like to start with Mrs. Parks. She was a lifelong radical and rebel. She got in fights when she was a child when people had mistreated her. And she fell in love with her husband Raymond in 1932 because of his involvement with a case called the Scottsboro 9 case, in which 9 young men had been falsely accused of rape in Alabama. And the Communist Party of America financed their criminal defense, and he became a community organizer in the effort. He was a barber by trade, and she said he was the first man radical enough for her to marry. In 1942, she and her husband attended their first NAACP meeting. They thought the NAACP was too elitist. It was mostly college-educated professional African Americans. But E.T. Nixon was running to be president of the local chapter. He had registered them to vote 2 years earlier. And he was a member of the Brotherhood of Sleeping Car Porters, which was the largest African American union in the country. And he was also, basically a butler on trains. And he was the first working class man to be elected to lead an NAACP chapter in the country. At that meeting, which was Rosa's first, she was the only woman in attendance and no one ran for secretary. And so she was nominated and elected secretary, and she held that role for over a decade. And it's important to note that one of her jobs was documenting all of the cases of racial discrimination, mistreatment, and abuse in the community. So she was the repository for all of the community stories of abuse and discrimination for over a decade. Through the NAACP, she went through trainings in Georgia and Florida by the master organizer, Ella Baker, who was head of the field division of the NAACP, who saw her as a real emerging leader and corresponded and mentored her but also encouraged her to create a youth council, which Rosa Parks did, in which she engaged young people in Montgomery to stand up to segregation. Then one day she was working in her role as a seamstress for Clifford and Virginia Dewar, who were the town's leading white liberals. Clifford was a New Deal lawyer who'd moved back to Montgomery. And Virginia talked to her about her NAACP work and recommended that she go to the Highlander Folk School in Tennessee, where they ran trainings in nonviolent civil disobedience for diverse groups of people. And Virginia Dewar ended up raising money among her friends and neighbors to sponsor Rosa Parks to go, and took the bus with her to Highland and back to make sure she got there safely. At Highlander, for the first time in her life, she was in a group, a mixed-race group of people who treated each other equally. And she was trained by Septima Clark and Miles Horton, who also saw her as a great leader and began corresponding with her about her work in Montgomery. Then a young African-American lawyer moved to Montgomery who was the second African-American lawyer in Alabama, the first in Montgomery. His name was Fred Gray, and he was 24 years old. Rosa Parks took him under her wing and began meeting with him for lunch every week and bringing him these cases she had been documenting to see which of these cases could be turned into legal cases against discrimination in Montgomery. Then in February of 1955, Claudette Colvin, who was 15 years old and a member of Rosa Parks Youth Council, refused to move to the back of the bus in Montgomery and was arrested. Now, a lot of people don't realize that Rosa Parks was not the first to do this. And Claudette, Rosa Parks, and Virginia Dewar fought vigorously with the male leadership for them to take on Claudette's case and use it to challenge segregation in Montgomery. But the male leadership decided that she wasn't sympathetic enough. She was too dark-skinned, too poor. She was a kid. She had allegedly resisted arrest, and there were rumors she was pregnant. So they ended up not taking her case. 8 months later, in October of 1955, Mary Louise Smith, age 18, also a former member of Rosa Parks Youth Council, refused to move to the back of the bus in Montgomery and was arrested. Mary Louise was very, very poor. Her parents lived in basically a shack, and her father was a raging alcoholic. So again, the lawyers decided that her case would not be sympathetic enough and decided not to pursue it to take on segregation in Montgomery. Then December 1st, 1955, Rosa Parks refuses to move to the back of the bus in Montgomery and is arrested. Now, on the 100th anniversary of her birth, the White House proclamation called her an inadvertent activist. The New York Times in the obituary said she accidentally started a movement. I'm guessing by now you realize she wasn't accidental. Edie Nixon and the Dewars go to get her out of jail and go back to her home and spend the next few hours with her and Raymond. This is a Thursday night, deciding whether they would be willing to use their case to take on segregation. Rosa knows she will lose everything if she does that, but she and her husband make the courageous choice and decide to stand up and be the case to take on segregation in Montgomery. Edie Nixon calls Fred Gray to represent his friend, and then he called Joanna Robinson, who headed the Women's Political Council in Montgomery, which was an association of African-American professional women who'd been calling for a bus boycott for 2 years. And he tells her, we're going to start a bus boycott on Monday. And Joanna Robinson goes to Alabama State University, where she works as an English professor at a historically black college, and overnight produces 35,000 flyers announcing the boycott. And the women meet her Friday morning and fan all the bus stops in Montgomery with the flyers. I still can't believe, I was actually at the National Civil Rights Museum in Memphis on Friday and saw the actual flyer, and I still don't conceive of how she made 35,000 flyers overnight. They have actually a picture of the machine, too. Then Edie Nixon called Ralph Abernathy at Holt Street Baptist Church, who was really a leader among pastors, and asked him to pull together all the pastors Friday afternoon for a meeting so that on Sunday they could call for the boycott from the pulpit. And he said, well, I've got this idea. There's this new pastor in town and no one knows him. Let's do it at his church, because if he gets run out of town, no one will notice. And that's how 26-year-old Martin Luther King was drafted into the movement and hosted that first meeting of the pastors on Friday. Reverend Robert Grace was the only white pastor to attend that meeting and happened to be Rosa Parks' pastor. His home was bombed in retaliation for his attendance. They decide to boycott that Monday, and no one takes the buses. And they have a meeting at Holt Street Baptist Church that night. A mass meeting with over 2,000 residents came. And they take a unanimous vote to maintain and sustain the boycott. They decided to create an organization, the Montgomery Improvement Association, to sustain the boycott. And Rufus Lewis was a business owner, college-educated man who had lost several elections to E.D. Nixon to run the NAACP and didn't like the fact that an unlearned working-class person was beating him. And he didn't want E.D. Nixon to run the Montgomery Improvement Association. So he had the idea that they should elect someone who was totally non-aligned in the community and had no set alliances and was totally neutral. And so he nominated his young pastor at Dexter Avenue Baptist Church, Martin Luther King, to be head of the Montgomery Improvement Association, hoping he could pull the strings behind the scenes. King gets elected. He calls his father in Atlanta, who's a prominent pastor, who connects him to a pastor in Baton Rouge, Louisiana, where they had a bus boycott the year before. This wasn't the first. And that pastor tells him people will march for maybe a week, and then you got to figure out how to get them everywhere. And then Rufus Lewis organized a transportation carpool of 350 cars that transported the entire community to school, church, work, shopping for over 12 months. And they had a dispatch center, and Rosa Parks worked the phones at the dispatch center. To raise money for the cars, for all the gas costs and the tickets, because they got pulled over constantly, two women, Inez Ricks and Georgia Gilmore, created competing clubs of women who cooked food and sold it during the week to compete to see who would bring the most money to the mass meeting every week for the movement. Then Ella Baker took Rosa Parks on a tour of the North to raise money from NAACP donors. The Doers and the Hortons raised money from the Highlander Folk School donor community to support the effort. And then Bayard Rustin came to town. A. Philip Randolph was the Dean of American Civil Rights Leadership in the first half of the 20th century as the head of the Brotherhood of Sleeping Car Porters, and his master organizer and strategist was Bayard Rustin. Rustin was a very controversial figure. He had been the campus organizer for the Communist Party in America in the 30s. He had then gone to India and come back a committed Gandhian pacifist and served World War II in jail as a conscientious objector. He then, in 1955, was also an openly gay black man with a thick New York accent down in Alabama supporting the effort. So a very, very much an outsider, controversial figure. Rustin goes down, he meets with Nixon, and Nixon takes him to introduce him to Dr. King. King has a man on his front porch with a shotgun, a man on his roof with a shotgun, and Dr. King is carrying a sidearm. Dr. King had applied to the governor of Alabama for a concealed carry permit to carry a gun after his home had been bombed. And Rustin suggests to Nixon and King the idea of using this movement to practice a Gandhian nonviolent civil disobedience campaign. And the first thing he instructs King to do is get rid of all the guns. The second is that about 80-some members of the Montgomery Improvement Association had been indicted, and Rustin suggests that they all put on their Sunday best and march down to the jail and turn themselves in, which they did, which was really the first mass nonviolent civil disobedience campaign of the movement. And Rustin then moved to a hotel room in Birmingham so they wouldn't find this outsider in town, and he coached King every day for the next year on every step of the movement and for the next 12 years. He's the man who organized the March on Washington and much else. But Rosa Parks had been an officer in the NAACP for over a decade. Her husband had been once involved in an effort funded by the Communist Party. So they decided that she also wasn't a sympathetic enough person to build the case around. So another woman who refused to move to the back of the bus and been arrested, Aurelia Browder, it was her case that was argued to the U.S. Supreme Court that overturned segregation in the South. So the question is, who is the leader of the Montgomery bus boycott? And that's really how change happens. It always comes from the leadership of the many. And we need the lawyers, and we need the strategists, and we need the women who can do the grassroots work, and we need the guy who can coordinate the transportation. We need all of those skills. We need all of that experience. And so when we think about building the collective and the collective leadership, we have to think about all the ways in which people can participate and all the ways in which people can lead. All of those individuals took responsibility and took that active leadership for what they could do to contribute to the overall results. And that's the kind of leadership we need in collective impact. The other piece is about practicing values. And I want to talk, and the Army uses as their leadership manual the concept of be, know, do. First, I have to understand who am I as a leader, what are my values, what's my mission, what am I good at, what am I not good at, and I have to master all of that before I gain the knowledge and skills to achieve that mission. What I would argue is most leadership development programs on campuses and communities focus on the knowledge and skills of leadership, and very little focuses on the B. But when you think about the worst boss you ever had or the biggest pain in the butt on your committee, it's usually not how smart they are or skilled. It's about the values. It's about whether they listen to other points of view, practice what they preach, fulfill their commitments. And so we need to focus on values that people need. And I'm going to walk through 5 of them kind of quickly to kind of illustrate the kind of values that make this work. The first is about being asset-based, and we think about the proverbial glass and whether it's half empty or half full. And what I would argue is that glass is like every single one of us today. Every single one of us has fullness. We all have gifts and talents that make us great family members, great friends, great workers, great leaders, and we also have emptiness. And the problem is too much of service and leadership is people who define themselves as full going into communities that are defined as empty to help people who've been labeled for their emptiness with the notion our job is to fill them up with our fullness. We think that at best is arrogant and at worst is oppressive, and we think that leadership is about being able to see the fullness. Even when we're staring into someone's emptiness or a community's emptiness, a leader's job is to find that fullness and build the relationship there. Our best friends who we share our challenges with, we do that because we know no matter what we share with them, they'll always see us as full. Yet when we build relationships in community, we often build them in a place of emptiness. And when we think about community engagement in that respect, we have to be clear where we're going to be in a spectrum. And right now there's an article I just wrote on the Stanford Social Innovation Review called Community Engagement Matters, and it has this table among other things, and it's available to non-subscribers if people are interested. But wherever you choose to be, not every effort can have total self-determination, local control. But whatever promise you make to the community, you have to fulfill. If you say you're going to involve people in decision-making, they have to be involved in decision-making. If you say they're going to collaborate in producing the results, they have to collaborate. And if you're only going to inform them what you're doing, be clear about that. The second value is about inclusion and equity. And a lot of groups today talk about an equity lens, and they talk about how do we start to disaggregate our data, identify disparities, and differentiate services. I would argue it's even more important to focus upstream and build an equity mirror and ask ourselves, who's at the table deciding what we're going to do, what the problem is we're solving, what the solutions are, and interpreting the data. How is the view of our table distorted by who's not at the table? If we don't have people who deeply understand the community, the problem, and the neighborhoods we're working in, then we need to correct for that. And then we have to commit to correcting it, to making sure that our tables are equitable, that we have the right people making the choices and decisions. The third is about collaboration. Collaboration is really about trust. It's how do you do the active work of building trust with each other. And it's important to recognize that a lot of people think that collaboration is working well if there's no conflict. I would argue the opposite. I would argue that if there's no conflict and people are being too polite, what you want is constructive conflict. And that's when people can give each other difficult feedback, when they can disagree with ideas and share opposing points of view, when they can hold each other accountable for their work and their promises. And to me, that's constructive conflict. You can only have that if people trust each other enough and see each other's fullness that they can have those conversations. Otherwise, we have destructive conflict, and that's when people leave the meeting and bitch about everyone in the meeting. The fourth is about continuous learning, and the story I like to tell here is about a decade ago, the Echo and Green Foundation asked me to speak to their fellows starting new nonprofits about what I'd learned building public allies. And I built that and realized it wouldn't help them and created a presentation called The Worst Practices of Social Entrepreneurship. And before sharing this publicly, I thought I should share with my staff. But it's scary because the first slide was called Things I Suck At. And it was a list of things I suck at. And I put this in front of my employees. And it was very scary. And then something happened. Everyone started nodding. And the reason is because the things you suck at aren't a secret. If you're always late, everyone notices. If you talk too much and don't listen, everyone notices. And the problem is, when we hold on to these things and are defensive about it, that's what creates destructive conflict. That's what pushes people outside the room. Because if we own it, people can talk about it with us. If we don't own it, they talk about it without us. But everyone knows it. And that's true for our organizations also. If our organization sucks at things, trust me, everyone knows it. And if we can acknowledge it, that's the expressway to the trust we need to collaborate. And continuous learning really is about how do we build that vulnerability of self and organization? How do we own that we're not solving the problem alone? How do we have authentic, transparent processes? How do we use data to learn and adapt if we're actually moving the needle? And recognize that a collective impact is emergent. It's something that we learn as we grow, and we're constantly in a learning process. And finally, it's about integrity and how we be true to yourself, to your be, to your values. How do you be true to each other and to the result for the people you serve, and always holding that result as central to your work. So those are the 5 values that I think are great values for a collective impact to organize around. And if people intentionally build and talk about those values and practice them together, then it's going to make that culture the kind of culture that won't eat your strategy for breakfast, but will be the dessert on an awesome strategy. So with that, I want to kind of go back and see if there's more questions that people have.
Sure. Thank you so much, Paul. We've got a couple questions that have come in throughout the presentation. Specifically, you talked about organizations sometimes needing to give up the work that they do to align with the mission of collective impact.
Yeah.
Can you talk about how long this takes, and could you maybe give a few examples of that?
Well, how long it takes is something that depends on the plan and the strategy and the work that's being done. But I think that in any planning process, I think what groups have to do is be willing to put what they do right now on the table and open it up to the rigorous analysis of when we know this is what solves the problem and this is what our program is, how do we align what we do with what we know will move the needle? And I think that in any effort, it requires groups to be willing to shift what they do. And it requires, and if everyone's doing that together, it takes the pressure off any one group. Because if the outcomes we're individually achieving are so great, then the problem would be solved. But the reality is the reason why we're doing collective impact is despite the good work we're doing, we're not moving the needle for the community. So we have to be willing to change and shift the programs we deliver to conform with the evidence and data we see embedded in the context of our community to solve the overall result. And so how long it takes is really dependent on the planning process overall, but typically just the planning of collective impact is a 1 to 2 year process. And I think that you can't do collective impact as a 2-year or 3-year program. It's probably a 5 to 10 year commitment. I mean, the team pregnancy effort in Milwaukee was a 7-year plan to cut the teen pregnancy rate in half. And they did it by 57% in 7 years. Now they've set a goal for the next 7 years to cut it in half again. That's a 14-year life cycle. This isn't a grant cycle or an election cycle. It's really a long-term commitment to change. And you have to be willing to change your organization based on the results.
Great. Thank you for that. Thank you for that question as well from our audience. We have a couple other questions. Do you find that the technical approaches to dealing with a complex issue becomes the small wins while the collective is working on more adaptive approaches?
Yes, and I think that's a great point. And I think that, and in our article on community engagement, we talk about the need to build momentum. And the hard part about collective impact is it takes a while to get to that kind of needle-moving change. And you have to have some quick wins in the process that give people motivation that this is working and on track. And so I think it's helpful at times to find what are those technical things in that low-hanging fruit you can kind of solve now, because we know if we can get some progress on that, it'll move the overall result. But it'll also show people and start to change the narrative that, there's so much of a narrative that problems are intractable. And this is about proving that problems can be solved. And so you do have to gain some traction on them to do that.
Great. A couple more questions here, if that's okay.
Yeah, please.
Keep rolling. So what can we do about government and the inflexibility of government and pulling government programs in? Do you have any words?
I get to make America. I'm not going to. So I think that what we have to, so government has to be at the table at these things. And I think that the challenge is, as you say, there's a lot of red tape that often silos government programs from each other, even to the point of there are government funds where if you receive funding from that program, you can't receive funding from another government program. And then you can't build that systemic solution. And so we need to have we need to be at the table with government, helping them think differently about their work. Now, at the federal level, the Collective Impact Forum, the White House Council for Community Solutions had recommendations. The Collective Impact Forum is definitely in working with federal agencies. I know Strive has, Living Cities, other groups, to try and change grant processes to facilitate and support this kind of work. For cities and states, I think it's also often that they've been at the table. And in Milwaukee on the Life Course Initiative, Mayor Barrett is at the table, and a lot of his deputies and staff are at the table. And so we're working with them to figure out how to solve problems and have their leverage where we need it. And so I think that the ideal is to have government at the table, and at least at the federal level or the state level, it's really working with them to figure out how are they impeding the result. And again, I think what they want at the end of the day is that result. So how do we hold that result and the promise and the evidence we're using as a way to commit them to potential policy changes that will help us accelerate our results?
Great. Thanks, Paul. Thanks again. A couple more questions. Does that sound okay? All right. One of them, which is, I'm sure, on everybody's mind, is what is the role of funders in collective impact?
They should put all the money up front and leave them alone for a decade. I wish. No, I don't wish, because actually where it's worked best is when funders are deeply partnering. And that means that the funders are helping design the strategies. They're helping leverage resources behind shifts in strategy and work that need to happen. Early on in one of the Strive models I visited back when we were doing the White House Council, they talked about how there were 14 mentoring programs in this community, and they would meet every month with someone from the school district and someone from the police department. They'd look at data together and figure out where they needed to deploy mentors. And there were funders at that table who would put resources behind those deployments. And so, yeah, I keep looking at Tom here. But what would happen is that they would notice that there were schools where truancy had increased. And so rather than 14 mentoring programs having grants to mentor kids who came into research, they were figuring out how could they together deploy mentors to that school. And then the funders were putting money behind that. And so ideally, funders are acting in a partnership way where they're both making dollars available to the process, but also allowing their dollars to be set and moved by the process to fund the work that has to happen to move the result. And so I think funders have to be at the table, and it requires them to be in a more collaborative mode, to be in a more facilitative, emergent mode, and to have some trust in the process. But again, if the process is rigorous about its results and its data and its evidence, then that's what the comfort is for them to trust the process.
Great. Got a few more here. I don't know if there's anything else that you wanted to add into the presentation, or should we just wrap it up with a few more questions?
I'm just all questions.
All right, great. Well, once again, keep them coming. But we've got another question with maybe some hints on how you can help find and access and analyze data in a way to find the root causes of big, complex things. For instance, high school graduation rates. Doesn't everyone have their own organization or program serving that data, or can you provide any tips on how to find that data?
Well, I think a lot of collective impact efforts have partnered with universities, and I think one of the great things that, you know, in our Life Course Initiative, for example, in Milwaukee, the School of Public Health, the City Health Department, University of Wisconsin Medical School. I mean, we've got a number of researchers who are at the table. And the reason why we have the data is because we have people at the table who can get the data and understand the data and can help us process and interpret it. And so I think you need to have people at the table who can bring that. And I think that, again, it's not about a program's data, it's about what do we know. And then you have to look at what are there communities that have solved this problem, and what are the strategies they've used. What do we know produces higher third grade reading scores if we know that it has bearing on long-term success, and 8th grade math scores, and what do we know gets kids on track in 9th grade. There's a lot of research on these things right now. And, you know, I do think that something like education is very complex. I know in the health field, the focus now is mostly on social determinants of health, and I've been waiting to see if that will happen in the education space, where we'll start dealing with that as well. Because it's not just what happens in the school, it's what happens outside the school that matters to the success as well. And so again, we need the collective because these aren't siloed in people's lives. They're problems that exist in a systemic way. And so again, I think we can go to data from people who that's what they do. But then we have to interpret that data with community. There was a story in the Chronicle of Philanthropy 2 weeks ago about a program in Boston that set up these two outcomes that was focused on economic empowerment of women. And they had received this long-term grant, and the goal was to increase both hourly and monthly income for women. And what they found was over time they had increased hourly income by a lot, but only monthly income had gone up by half as much. So they thought they had failed, and they were trying to figure out what had happened. And when they interviewed the women, they found out that for most of the women, the increase in hourly wages allowed them to spend more time taking care of their kids. And what they realized is they had a different set of assumptions about what these women wanted than what these women wanted. And they realized that they're privileged, and they had no one at the table making the decision or interpreting the data on the front end who understood the community. And so we have to, while we're data-driven, we always have to process data through the context of community and people who understand the daily lives and what this data means and make shared meaning out of the data together, but with community, because it's their life. The data is their life and their experience. It's not just numbers.
Great. Okay. We've got one other comment that I'm going to kind of twist into a question.
Okay.
One of our participants had mentioned that when they do work with government, they're including both high-level officials as well as folks who are doing the work at different times during the process. And they're finding that being very useful. I guess my question, I would just kind of turn that in, is have you seen that? And how would you, what's important? How would you pull both sides together, and how do you find common ground?
So I think, again, ideally, it's really about, within any institution, I learned this from working with universities for a long time in my former organization, as well as working with government. Every institution is filled with people. And the question is, who are the people who are the navigators? Who are the people who know how to move things through and get things done? And those people can exist at multiple levels. And what you're looking for are the people who can really help you get things done. And sometimes the top leadership can grease the wheels and make things move faster and accelerate things. Sometimes they're actually the barrier. So I think it's about finding those people who are really committed to the result and the goal, and who know how to navigate the processes and systems to get things done. And I think that ideally you have people at multiple levels in large institutions, because you're going to need that to get things done. And certainly in the efforts I've been involved with, it's never been just a mayor involved or just a low-level city administrator, but it's been typically people from various agencies and various levels. So I think it's important to operate at multiple levels. Great.
Well, thanks, Paul. I really appreciate you taking the time for this. I'm going to go ahead and, if you wanted to turn off your webcam, I'll get my section up here, and we'll get rolling here.
And I just wanted to say in closing that, if people have additional questions, feel free to tweet me at @PaulSchmitz1. Again, it's hope that this is helpful. And the CollectiveImpactForum.org website has lots of resources on collective impact. It's free to join, lots of resources. And leadinginsideout.org is my website, which has a lot of other information on these things. So thank you.
And we'll also be including that information that Paul just spoke of in the follow-up email that we'll send to all attendees. So please join me in thanking Paul for this outstanding presentation, and BMO Harris Bank for their support. As with all of our webinars, we did record this webinar, and we will make it available for playback from our website. We will also be sending up a follow-up message to all attendees and registrants with links to more resources from the presentation and the aforementioned link to the recording. I would encourage all of our participants to review our website at forwardci.org for more information on how forward community investments might help your organization. Our next installment of our webinar series will take place on Thursday, April 28th from 1 p.m. to 2 p.m. We're excited to have Jordan Bingham from the Public Health in Madison in Dane County, Colleen Butler from the YWCA Madison, and Angela Russell from the CUNA Mutual Group presenting on using racial equity tools to build organizational equity. You can register for this webinar on our website, and we'll also include a registration link in our follow-up email. One final note, when you close your browser from this session, you will be directed to a very concise questionnaire to evaluate today's webinar. Please take a few minutes to complete to help us continue to improve the effectiveness of these offerings. Thanks again to BMO Harris Bank for making this exceptional learning opportunity.
Woohoo! Thank you.
All right, thanks BMO. Happy spring, everyone, and take care.